Hi, I'm Dr. Dan Cohen with Levine Clinic of Chiropractic here in Farmington Hills, Michigan. For over 60 years, our office has been one of the leading providers of chiropractic care and spinal decompression in the Metro Detroit area. Today we're going to answer some of the common questions that chiropractors we face. And so if anybody here has a question for me, I'd be happy to answer.
Dr. Cohen, I hear a lot of different things when I ask people what they know about a chiropractor or chiropractic. And what are some of the common misconceptions that you hear?
Well, it's interesting. The question is, what are some of the common misconceptions we hear about chiropractic? When a patient comes into my office for the first time, a lot of times they're coming with information that they've gotten from other people, whether they're medical doctors, their friends, and usually it's a person who's never been to a chiropractor. So one of the first things that that we hear is that, you know what, I just don't believe in chiropractic. And guess what? Chiropractic's not a belief system. Chiropractic is based on how our body works. And it's this simple. Our brain sends messages to our body via a band of things from the nervous system. That nervous system is housed in the spinal cord. That spinal cord runs through your spinal column. When there are misalignments in that spinal column or pressure on that spinal cord, then we're going to have a problem wherever that nerve or nervous system is supposed to interact with. This isn't something to believe or not to believe. It's basic anatomy 101. The brain sends messages to your body, and wherever part of that body, whether it be your legs, your back, your stomach, if it's receiving 100% of the brain's messages, we have normal function. And if it's not, then somewhere in our body is going to start to malfunction. So that's one of the main misconceptions. The other one is that maybe, once I start with a chiropractor, I have to keep on going. That's something that we hear all the time also. Whereas it's true that when you first go to a chiropractor for an acute problem or a new trauma, that yes, you might be there more frequently at the beginning of care as your body's starting to understand how to correct itself and where to be in the right position. As time goes on, as your body adapts, then no, you don't have to return all the time. But do you have to come once in a while? Yes. Do you go to the gym? Do you stop going to the gym once you start? No. To maintain your body, you have to keep going. If you want to maintain your teeth, you go to a dentist and you get checked up at least a couple times a year. Well, in working with your body, you're constantly moving. Everything I do, I move my arm, I move a joint. I take a step, I'm moving my hips and my back. So it's constantly moving. You have to constantly be working to keep it at working at its best possible functionality.
Dr. Cohen, why do our joints get stiff as we age, and how can you help?
Well, we can help that, and it's not just as we age. Sometimes when a joint has a trauma applied to it, or there's been a trauma, things start to degenerate. As we get older, we naturally start to degenerate. Our spinal discs start thinning out, they start compressing on each other, and the one way to keep these things moving properly is by movement. So as we stop doing a lot of the things that we did when we were younger, we're not running around the streets, we're not playing ball all the time, you're sitting in your chair all day at work looking at your computer, or you're standing all day leaning over a podium if you're a teacher, or whatever profession that you do, you find yourself in the same positions. I could ask you, Bruce, when's the worst time when you feel the most stiffness? It's probably going to be the morning. Why is it in the morning? Well, guess what, people? Most of us don't move very much at night. We're lying down in bed for 5, 6, 7 hours, and then all of a sudden you wake up and you get out of bed, and you get up, and you feel it because you're stiff, and then you walk around, you get a little hot water on the shower, and it feels better. So how do we help it? We keep those joints moving. When you get adjusted, it's a movement of that motor unit, that joint. And when that happens, you produce what's called a synovial fluid. It's your body's motor oil. And that keeps your joints lubricated, can help slow down the degenerative process, and therefore can reduce some of the pain that you're feeling or stiffness or discomfort.
Thank you.
Dr. Dan, what are some of the unique problems that you've taken care of with chiropractic care?
Well, it's an interesting question, Doug. And chiropractic can really encompass so many different problems because your nervous system controls everything. There's not a cell in your body that's not controlled by a nerve, an action. And so, people come to us mainly, they think my neck hurts, my back hurts. And then after undergoing some care, they all start realizing, you know what? I'm not having that acid reflux like I used to. I'm digesting my foods better. And man, I'm waking up, I got more energy than I've ever had. Or, you know what, I've been having migraines for a long time, and now since you've been working on my cervical spine, my neck, I'm not having any of these migraines anymore. So there's a lot of things that can be helped. Asthma, sciatic pains in your legs, pretty much anything. Now, that's to say, does chiropractic cure anything? No. We don't cure anything. What we do is let your body get into a place of homeostasis so that it can take care of itself, so that it can act the way it's supposed to. And so if there is a misalignment causing a problem, and you remove that, then we're going to restore function to that area. And if that problem that nerve is going to is one of the things that you're complaining of, it could help.
Another question, follow up on that, Dr. Dan. Are there different techniques for different conditions?
Well, yes there are, and it's not so much conditions, but almost like personal preference. A lot of chiropractic is done with hands. In fact, the word chiropractic comes from with hands only. And so we apply a force to your body, and it's called an adjustment. I'll press on you. Now, there are some people that might be in too much pain, or are too sore, or just don't like to hear the noise, the popping, or something, and they're just kind of scared of that. Or they're too young, or they're too old, or they have some other type of bone disorder where you don't want to apply a force. And via proper diagnostics, you determine what technique you can do or what you cannot do. So being in practice for over 30 years, in my office for over 60 years, we're pretty much in tune with almost any technique that's been around. So we use our hands as one technique, but we also have an instrument called an activator, which is an instrument that we allow to adjust the spine without applying the same force that you would normally do. So it's a light force, and it's usually used for more people, like I say, who are either older, whose bones aren't as strong, or just have an aversion to hearing it. They don't like to hear the noise. They don't like to feel being pressed on. And so yes, we can work with any different type.
Dr. Dan, I know this question is as broad as it is wide, but how could a chiropractor, physical therapist, and or a massage therapist possibly work together and or refer to each other? Is it possible? Does it happen? Or do you usually go one way or the other?
You know, it should happen. And it does happen in a lot of cases. The medical model should be a team. If you come into my office, I should be part of Team Craig. And if you need to go see a physical therapist, I'll send you to one. If you need to have, if I think a massage or massage therapy would help you out, I would have that done. If I think you should go see an internist or a neurologist, we're all on the same team. You've hired us. We're working for you. And so, you know, here's the difference though. Physical therapy, massage therapy mostly deal with your muscular system. All right. Chiropractic is more for the structural system. Okay. And yes, muscles are attached to bone, so they go together. And so my patients who do both respond the best. Because if your muscles are loose, the adjustment that I give you when I adjust you, realign you, and your muscles are no longer taut and spasming or pulling you one way, it's going to hold better. If you go to a massage therapist and you have a lot of the toxins that are collecting in your muscles, and you have a lot of acupressure or trigger points, well, you need to have that resolved also. And if you have a massage therapist can get rid of all those things, and again, decrease the tension in the muscles, my job will be that much easier. So yes, I do refer to massage therapists. I do refer to physical therapists. And I have physical therapists and massage therapists refer to me, and our patients get better the best. Is that to say that everyone does? No, because unfortunately there are still some old-time prejudice, or for whatever reasons, you know, that your physical therapist won't want you to go to a chiropractor or vice versa, or a massage therapist. That's not how we operate. Again, it's Team Craig, and whatever we can do to help you, we will.
Thank you.
Doc, Jordan Tracy here. Is a chiropractor a good fit and resource for people of all ages and conditions?
So who should see a chiropractor? Is there any restrictions? Can you be too old or too young? No. Everybody has a spine. Okay, they're not all the same. So we have different techniques. I have had in my office a 3-year-old baby. I've had them bring them to our office on their way home just to get checked out. Now, do we treat a baby the same way we would treat an adult? No. Obviously, there's different techniques, there's different structures, there's different stages of development. So we treat them differently. But we do, it's very important that you make sure they're aligned. Hey, when you are born, that's a rough trip coming out. And there's a lot of pressure being pulled on your head, if you think about it. And it doesn't, you've held a little baby. It doesn't take much. So yeah, it's real important that we just check it out, make sure it's straight. On the same token, I've got a 94-year-old patient who comes and see me regularly. Okay? Again, the same techniques as I would treat with you? No. Sometimes I'll use that as we referenced, we have different techniques. So I'll use what's called an activator. It's a very low force, gentle technique. But yes, anyone can come at any age, at any time. If you have a spine, we can treat you.
Thank you very much.